All right, so let's get started. Good morning, everyone. For those of you in the U.S., good afternoon on the East Coast, and good evening for those of you in Asia or Europe. Thank you for joining. What we want to do today is give you a sense of some of the interview preparation basics and how you can prepare. So by the way, this is for participation in the webinar. You can use your computer microphones to listen in, and most of you already have been using this chat system. So this looks good, I think. And if you have questions, you can either type in or raise your hand on the top of your screen. There you should see an icon where you can raise your hand for any questions that you have. So what we wanted to do today was, this is the second in the series of the webinars that we are hosting. The first one was mostly around application process, the application personal statement. And now we thought it would be a good idea to give all of you some sense of what the programs look for when they are interviewing the applicant, some of the interview basics that you should be aware of, how to start your interview preparation, and some of the challenges that we've seen IMGs face in the interviews, and finally, how our team can help. So before we get started, we do have folks from our panel, and some of them will be joining a bit late, and also we have students from the last year's math. So I heard Nishant already. I don't know if anyone else is joining, but we'll see. But let me first open it up for the introductions. My name is Pawan. I'm MBA and adjunct faculty at Carnegie Mellon, and I've been a former program director and admissions committee member. I'm part of the team. So let me give it to Rahul. Rahul, you're on.
Good morning, everyone. My name, I'm a gastroenterologist here at the Mayo Clinic in Arizona, and we've been involved in this process, and our goal is to really try to help. We've walked this path before, so our goal is to sort of try to help, folks achieve the best that, they can. So, looking forward to working with some of you.
Yeah. Nandita, are you there?
Yeah, hi everyone. My name is Nandita Khera. I'm a hematologist oncologist here at Mayo Clinic, Arizona. And we hope that after listening to the webinar today, you will have some idea of what we do and how we can try and help you successfully maneuver the path to residency.
Thank you. And I know Mohit and Manisha will be joining slightly later. All right. So Nishant, you want to introduce yourself?
Yes. Hey, this is Nishant. So I'm a PGY-1 urology resident at University of South Carolina. So I just recently passed through the stage which you are going to experience. So any questions I will be able to answer you guys.
Thank you, Nishant. Anyone else? I know Deepak was supposed to join. Deepak, are you on? Abhilasha. Okay. We'll see. If they join, then they can chip in as well. All right. So just about our mission and our team. So as you can see, we are a group of physicians and MBAs, and we seek to guide the IMGs like yourself in the quest for match for the residency positions. And what we have is a very good knowledge of the U.S. medical system, given the backgrounds. We understand the challenges that IMGs face, and we try to provide a very customized approach to our students. Now, here's a sample. Hi, who joined?
Hi, Pawan. This is Abhilasha.
Hey, Abhilasha. How are you?
Good. How are you?
So Abhilasha, we just started, and why don't you introduce yourself to the team here? We got about 40 students on the webinar. So do you want to introduce yourself?
Okay, my name is Abhilasha Singh. I'm one of the PGY1s at MedStar Union Memorial Hospital here in Baltimore. And yes, I'm here to answer maybe any questions or queries or help you in any way that I can. And yeah, that's all.
Thank you, Abhilasha. So yes, as I was saying, last year students like Abhilasha and Nishant and others, they had a successful year. Some of the places where they matched, university programs, community programs, internal medicine, PEDS, neurology. So we had a good year last year. So that was just a bit about ourselves. And now let's, get into the meat of the presentation. So first is the timeline. All of you should, be aware of some important days and months. Typically, the interviews will start coming in late September, early October. Last year, we did see one phone interview around 23rd September, but I think that's an outlier kind of a situation. You will see mostly early October. Interviews go on from about mid-October till just about Thanksgiving, which is the last Thursday of November. And then, that week is a fairly slow week. Then they start again early December, go on till about Christmas or right before Christmas. And then they continue in January. And then you will see tapering off towards the end of January. The important thing here to note for you guys is there are a lot of cancellations, both by AMGs and IMGs towards the end of December and January, as people get 10, 15 interviews, so they tend to cancel it. And it becomes important for those of you who may still be looking for interviews, that would be a good time to read to the programs where you've not heard back from and see if they can accommodate you in the interview process. January is also the time when many of you would be doing second visits. Either the program will extend that invite to you, or you may be interested. So second visit is where in January mostly. In terms of the interview types and format, and I'll just give it to Abhilasha and Nishant as well. Typically, you will see the traditional one-on-one interview when you go to the program on site, 2 to 4 interviews, maybe 20 to 30 minutes each. But it has varied and it keeps on evolving with the specialty and even within the programs. So several programs will do case or scenario interviews where you may actually be presented various cases, a series of cases, and you may have to do it. It could be written, or they could just ask you. There's a pre-interview phone screen. A lot of programs are starting to do that, where before inviting you over, they would want to talk to you over phone. And some of them will want you to fill up a pre-interview questionnaire as well, and based on that, probably they will filter out. Then there could be a panel interview also. So you may not have 2 to 4 interviews. You may just have one interview with 3 or 4 people on the panel, maybe 40 minutes, and that's the way they could do it. So there are variations, and let me wait here and see Nishant, Abhilasha. Have you seen anything else, or what was your experience last year?
So should I go ahead first?
Yeah. Oh.
Yeah, go ahead.
So for my MedStar interview, we had exactly like how Pavan mentioned. We had like 4 different attending interviewing us, and we also had like a resident interview. And except for the program director interview, every interview would start with like an ethical case scenario, and then they would kind of keep grilling you about it, and from there on it would go to like whichever direction you decide to answer, and then ending with, do you have any questions for us? So that is how MedStar was. For the another interview that I gave in North Florida Regional Medical Center, they had 2 attendings together, so that was like sort of a group interview, and anybody would jump in and ask a question at any point of time. And they did have a phone screen before they called us for an interview, so they did that. So yeah, pretty much what Pavan covered.
Yeah. Nishan?
Yeah. So mine were all like mostly neurology, like other than like 2 or 3 preliminary internal medicine interviews. So we had like for neurology, for most of the places I interviewed at like 7 places for neurology, and most of the places had like 3 or 4 interviews, each lasting 15 minutes. And they were like more kind of friendly because they're not testing for any kind of knowledge or anything. They just wanted to know how you are, because neurology being 4 years, they just wanted to see how you will fit in the program. So it's kind of mostly friendly thing. So they would test. They asked me why I like neurology and why I came to United States instead of choosing my own field back in India. So those were like the questions mostly, and I never had any difficulty. So what they wanted to see was how we communicate and what sort of interest are we showing in the program. So most of the interviews had pre-interview dinners, and the residents used to come. They used to observe you, how you mingle socially, and are you interactive. And as Pavan was saying, they used to involve us in the case reports morning, then see how our participation is, are we contributing to that. Yeah, and pretty much same as what Pavan said, how it is. But for neurology, mostly it was like 4 interviews, and 1 or 2 places I had interviews with residents too. And that was thing. And for the internal medicine, I had like preliminary interviews. Wherever I went, I had only typically 1 interview. And then they used to ask me why, why you were choosing this place, what made you choose this place. Other than that, whatever Pavel said was that.
I think what we've learned is that there is a certain flavor to this. Some of the East Coast programs, some of the community programs are more likely to do more of a questionnaire, a case scenario, medical knowledge. They'll give you a case and you have to write a response to it, things like that. As you get more towards other specialties, for example, like Nishan said, neurology or family medicine, you're less likely to see all that. They're looking more for your personality, communication skills. So I think this case scenario and all this stuff is very internal medicine sort of specific.
Yep.
Yeah.
All right. Let's move on. So interview basics. Now we want to hear from you. What do you think are the key challenges that IMGs face in the interview process? Some of you may be going into the first match, others may be going into their second match, so second year. So what do you feel are the challenges? And you can type it in the chat box. We just want to see what you guys think before we give you our perspective. So yeah, you guys can type in, and any challenges that you see or you think you'll face in the interview process.
One of the questions is, what do they ask in the pre-interview screen or questionnaire? I think it's very significant. Sorry, anybody else wants to jump in, or otherwise I can? Okay. So usually I think what they would want is they'll give you 4 or 5 scripted questions that maybe an ethical challenge, or maybe tell me something about yourself, or what are your future goals, or things like that. So I think a pre-interview questionnaire or phone call or a video Skype and all those, I think, are basically to filter out. So I think those are usually very, very scripted. So, they're usually looking for very short, succinct answers. And subject-related questions, typically we're going to talk more about that towards the middle of the seminar. But what do you guys think are some of the key challenges that internal medicine or international graduates face?
I think they're typing. So let's see what they see.
For me, the main challenge, let me say what I experienced, and let me see what responses we get. For me, I think,
what we get.
Yeah.
Okay.
Initial few. Sorry. Go ahead.
No, I'm Nishant. I'm just reading what they're typing. So.
Okay. So as I see someone typing here, maybe communication difference. Yes, that's the main thing. Here, people are like we are not confident. We think interview is a big thing, but they just see how we interact with people, and we lack confidence because being a medical profession, we never had to face an interview. I never faced an interview before. I just came from intermediate to medicine, then here. This is my first interview going on. Yeah, so I was tensed, but they don't like it. And I don't have, before my first interview, I never had confidence, how can I face the interview, what kind of questions they ask, what they do, and how do they assess us. What they prefer is, how are you, how are you? And it's not like what you show, something new there in the interview. So that's what I feel deep. So gaining confidence. So you should have some kind of confidence that you'll be able to present yourself. They want to see you as you, but not like something new you are adding up or you're trying to show up. That's what I feel is.
Yep. Abhilasha, what was your experience in terms of the challenges you faced?
Yeah, so confidence wasn't. Most of my issues were trying to find a common ground to talk about, because everybody wants to talk about baseball and what games they went to and what's been going on, and I was like, oh my god, I'm clueless. So but despite that, you try and find something that you both can talk about, be it food or the restaurants around, or what movies, whatever you know about here, or whatever you know about life here that can that you can find common ground with, and then just talk about that. So that kind of gives you the confidence that you're not just, randomly saying stuff and you do know what you're talking about. And yeah, it's nice. Everybody likes to know what your experience in India was, because if I don't find anything else, I just start telling them stories about how, things are in India, or how it's different, or how it's similar, or whatever. And they're nice, actually. They always want to know. They always have questions. They'll ask you more. So just anything that you feel, comfortable talking about, just talk about that. Otherwise, the pre-interviews, was pretty relaxed. They're not kind of grilling you or anything. It's just how well do you do socially? That's all.
Yeah, as Abhilasha said, pre-interview dinners were to see how you socially or you mingle with people, and there's nothing like that to see you. But I have experienced this. People have their profiles on your phones, and each resident who comes there is gonna keep an eye on you. But there's nothing to scare. They're just seeing how you are. That's it, how you interact, and try to talk more about during pre-interview dinners. Try to talk more about the place, and first of all put yourself in a comfort zone there. Whichever you're confident, try speaking about that. And I remember from the place where I matched, one of the faculty was like, what are your weekend plans? When I just went, and he's like, hey Nishant, what are your weekend plans? Because that was Thursday interview, and I was like, I'm here and I'm going to stay here for a while, something like that. So what I would say is when you go for an interview, just put yourself in a comfort zone by just bringing up whatever you are confident at.
Yeah, I agree.
Yep.
And
Yep. Thank you.
So my pre-interview dinners did not have any attending. It just had a resident. So it was like way relaxed.
Oh yeah, I mean they're residents. Yeah, I agree. Like most of them places were residents, but I saw at one place where the resident has all the profile, and he was like, he just came and is like, "You're from so and so place, right?" I was like, "Okay, I'm from so and so place," and he has all my profile on his phone, like the whole. And then I talked to him because I know that guy. So after the interview, I talked to him. He said like, we all are given the information about the residents. I mean, the applicants who are coming. We just wanted to like, see whatever they mentioned in the application. They're just saying because you mentioned, right, what are your hobbies and what do you do and all this stuff. So they just want to check on you. That's it. But there's nothing like. Go ahead, sorry.
My hobbies were actually discussed by one of the attendings, and she actually kind of, was like, oh, so what do you like to do and stuff. And one thing that I noticed that at least every program director, they always want to know what you're doing at this moment. So where are you right now? Like, are you doing research, or are you volunteering? Because then they have something to talk about. So that is one thing they always would ask. So what are you doing now? So that
I think that's a very important point, Abhilasha. And for those of you who are applying this year, keep this in mind. Do not tell them you're doing nothing or you're just interviewing. They really, really want to see that you're working, whether you're doing observership, you're doing research. They want to see you being engaged and working productively rather than just doing nothing. So that's a very important point, I think. All right, so moving forward, so this is part of a survey. NRMP had carried out a survey, and this is, they're carried out in various specialties. This is only for IM, but pretty much you'll see the same flavor in all specialties. So you'll see the program director perspective when they rank again. So this is post-interview. In ranking, what do they consider? So, you can see percent citing that on one side and then average rating of that attribute on a scale of 1 to 5 on the other. So, as you can see, there are factors which have, implications for especially IMGs. Some of these are very AMG specific attributes, but a lot of them are very relevant to IMGs and skills that they need to build on. So interaction faculty during the interview and the visit. So as both Abhilasha and Nishant said, whether it's a pre-interview dinner or during the interview during that day, your interaction with them carries a lot of weight. Interpersonal skills. So, communication and interpersonal skills are very important, obviously. Interaction with the house staff. So other than the interviewers who all have interacted with. So as Nishant said, they are watching everything, whether it's a resident or whosoever. They are watching you, and how do you interact with them is important. Feedback from current residents. Your scores do matter in the end when they are going to rank you. They're looking at a portfolio that you bring. But of course, interview becomes very important. If you have, excellent performance in the interview, it can overcome some of the other relatively weak areas you may have, whether it's your year of graduation or, lower scores, attempts. I mean, your interview can actually help you overcome that. But keep that in mind that when they rank you, they will look at various things, various skills you bring, capabilities you bring, and of course, the scores and some of those things. So that's important for you to know. Interviews typically can make or break, so it's important for you to prepare well. And sometimes, as Nishant said, and Abhilasha also, because of the cultural difference, because of the thing that we are not prepared for interviews in our home countries. The systems are different, so we need a lot of preparation. And the idea here is the interviewer should remember you positively after the interview. That's where, like Abhilasha said, the small talk, talking about some of the things that may be unique to you or where you come from becomes very important. So, your confidence, as Nishant said, social skills, as you see the pre-interview dinner or even during the day of the interview, that becomes important. So there will always be some stock responses, some questions, tell me something about yourself, your success or failure or things like that, that you have to be prepared for. But your goal should be to take the interview in a very conversational manner. As Nishant said, it's all about trying to present who you are and being yourself, and that will get to the conversation side of the interview, which will be very helpful to you. Now, again, what interview is not, as you just heard, it's very few programs will actually check your medical knowledge. They will not do that. Most of them will assess the application of knowledge. So maybe through cases, through scenarios, that's what they will assess you on. They are not there to listen. Hi, who joined?
Yeah, this is Oct-Jan.
Hey, Mohit, how are you?
Good.
Hi, Pawan.
So Mohit, hey, is that Manisha?
Yes.
Hey, so we're just in the middle of the seminar. So why don't you introduce yourself? There are about 50 students on the webinar. So if you can introduce yourself.
Sure. This is Dr. Oct-Jan. I'm the clinical assistant professor at UPMC Mercy, University of Pittsburgh, Mercy campus. And I'm faculty for their residency program. And
this is Dr. Manisha Jam. I'm assistant professor at the University of Pittsburgh, and I'm a nephrologist, and I'm on the faculty for the fellowship program at University of Pittsburgh.
Thank you, guys. So we were just going through some of the important basics of the interview, and then we'll open up, for discussion. So the interview questions are not random. You should all know this. They are trying to test some skills, some capabilities, which we'll just talk about in a minute. But you should know every program has a goal. I mean, they are not interviewing just because it's fun. They have some specific goals in mind. They want to know whether they can work with you or whosoever for 3 years, 1,000 days, they have to work with you. They're not recruiting for a faculty position, so it's just very transactional, 3 years. Can they trust you? I mean, it's obviously a lot of liabilities and a lot of other issues. So can we trust you to get the job done? Long hours, a total kind of commitment. So they are looking for people who can get the job done, and they are looking for a fit. Every program has a unique flavor. They have their own hiring policy, whether it's the score, whether it's the year of graduation, and things like that. And the process is very subjective. It's it is what it is. You cannot control it, but you can only control your performance. So keep this in mind. What works for one program in terms of their criteria will likely not work for other programs, and there is subjectivity involved when it comes to the residency position hiring. Okay, and I'll just go over this chart before I open it up to our panel. Now, all programs look for a mutual fit, as we just said. So who you are, your professional, personal experiences make who you are. So what you have in your personal statement, what you have in your CV, all that becomes very important as part of the interview discussion. What do you want to do? So what are your immediate kind of short-term goals? What are your long-term goals for those of you who may be in research? They want to know that. Then, do you fit their target profile? As I said, all of them have a profile in mind whether it's a 260 score or a 200 score or year of graduation. So do you fit that profile? And finally, they also want to know, why are you so interested in them? You know, every program thinks they are very unique, and they would want to know, why are you interested in them? So that's how they assess the fit during the interview. But let me open it up. You know, Nandita, Mohit, Manisha, what do you guys think? I mean, you've seen applicants again and again over the years. So what do you think the programs are looking for? Mohit, do you want to go? Can you hear me? Maybe some issue. Nandita,
can you hear me?
Yes.
Can you hear me, Pawan?
Yes.
Okay. So yeah, you're talking about how you're a mutual fit in a program, right? That's
Right.
the point.
Yeah.
So, like, I mean, the ones we're looking at a few things, like, you know, some programs are looking at, you know, they're more research oriented, so they're looking at, do you have research experience? Some programs that are more clinical oriented, they are looking at how hardworking the student is. Can he handle a patient load? You know, is he going to break out under stress? Has he dealt with, like, this much census in the past? Then obviously, you know, everybody, you know, the other thing nowadays, people have externships and observerships. So one of the other things that I see that the programs are looking at, do you have any U.S. experience? So do you know the system a little bit? Are you aware of the U.S. healthcare system and how, you know, things work here? Like, what is case management? What are social workers? I mean, just having that is a plus. It's not a mandatory thing. I mean, obviously, your medical knowledge, your scores, all those things are definitely important. But, you know, so that's what I think, a few things.
Okay. Yep.
I think
Manish?
the other thing that they are looking for is consistency. So, you know, I think what is important is that whatever you have said in your application and your personal statement, you are able to validate that if that comes up in the interview, because if things don't align with each other, that is a big red flag. So that is something that you have to be extra careful of, what you are putting in your applications and personal statements at the time of applying, because, you know, those things will come up during the interview discussion, and then if the answers are different from what you've already said, that could be, I mean, there are things that would be different. Maybe, you know, you've had some additional experiences, so that's okay. But as long as there's no major contradictions between the two, and there is a consistent pattern to what you're saying, I think that is very important.
Yeah. Yeah. All right. Moving on, I'll hand it over to Rahul, who will take you through the rest of the presentation around, you know, how to start your interview prep. So, Rahul, over to you. I think you have the presenter rights.
Actually, I don't.
Okay, let me give it to you. Okay, now you should have the rights to move.
Yeah. So good morning, everyone. It's been a great discussion so far. I'll try to sort of hit a few things as we go and sort of give you an overview. I also want to thank Dr. Chandra for joining us. Dr. Chandra, are you on the call?
I don't know if he's on the call. I don't think so.
But
he runs a very successful blog. All of you, I'm sure, are aware of it. You know, he's very active on Facebook, and he really is helping out IMGs. So, thank you, Dr. Chandra, for joining. Yeah, go ahead.
So when you start your interview preparation, the first word there, I think what's important is that you have to prepare. It may be a very conversational thing. It may be, it may be case scenario based. It may be whatever the flavor is. The most important thing is you will do best if you prepare. And even if they're asking you about hobbies, or even if they're asking, small talk about your sports team, things like that, it's an uncomfortable or a different experience for a lot of you, and you haven't had this, so preparation goes a long way. And the preparation starts with everything that you have put in your application, in your personal statement, everything involving your personal, professional, volunteer experiences, everything that you've put in, what research you have done, if you have gaps. There's a question about a gap here that has come up. Low scores, other flags, prepare for scenarios, things like that. So the interviewer is looking at your profile, and they really could pick on anything. There's no scripted, thing. So they really are trying to understand who you are, what your potential is, how you're going to fit, and your job is to know your application inside out, have a theme, have a story, have your pitch. Like if you're meeting someone in an elevator and you're going down, can you sell yourself and give an elevator pitch? Starting from there to talking in depth about everything that's on your application is going to be very critical, and that's where the interview preparation comes into play. Now, the one big thing to know about is that anything on your CV and your personal statement is fair game. If you've, like for example, we had someone who put in chess as their hobby, and they ran into a attending who was interviewing them who was into chess, and so they quizzed them about opening moves and this and that. So it could be anything, and anything that you pick off your personal statement or your CV, you have to be coherent, you have to be cogent, you have to be able to converse at a deep level for at least 5 minutes. And any professional experiences that you put in on your CV or personal statement. What was your role? You guys are putting a lot about volunteer experiences and leadership and this, and you really should be able to talk about it. Same thing with hobbies, like we discussed. Sometimes, as Abhilasha was saying, the whole interview could be about something like that, but they're not just inquiring about your hobby. Let's say you do oil painting. When they talk to you about the oil painting for 10 minutes, they're not just talking to you to know what your level of oil painting is. What they're asking is, what they're trying to test is, if this person picks something up, will they do justice to it? Do they understand it at a depth that convinces me that this person has that commitment, has that knowledge, has the temperament to do something well and to do something nicely and be very good at something if they pick it up? Because that's the same thing they're going to see for the interviews, for your residencies. So before I move on, any other thoughts from Nandita, Manisha, Mohit? Anyone, please feel free to jump in at any point.
And Nishant and Abhilasha also, what was your experience on CV and personal statements, especially volunteer experiences, hobbies? Did they actually come up for discussion?
Oh, yeah, I'm starting. So I had a research experience, and everyone were like big on it. They were asking, what were you doing? They just wanted to know whether you might be an author, but they wanted to know like what's your contribution and are you thorough with the research? What was your hypothesis? How did you do? Yeah, and what made you motivated to do research? Because most of the places I interviewed for neurology were university programs, and so they're just asking me more on research things. What are you currently doing now? So I was doing as a volunteer research assistant at the place where I'm at now. So they would ask me, what is your current research goal and what are you concentrating on stuff? So exactly what Pavan and Dr. Panala was saying.
No, I think that's a very great point. That's something we see very often. Many of you are just out of medical school and don't have a lot of, you just sort of volunteering as a research assistant, and you're maybe just doing data entry or something like that. And so a lot of people tend to undersell themselves and say, oh, I'm just doing data entry. But that's not the point. What you want to know is project that, yes, you may just be doing data entry, but that's your opportunity to show that you understand the research question, you see where the whole project is going and all that, because at your level right now you may just be doing data entry, but the goal is that you'll progress and be able to contribute, and that you have an understanding of what you're doing.
Yep.
So moving on to sort of the interview, the nuts and bolts of the interview, and what are the main issues that we've seen, and some of the main issues that with IMGs, either we speak too softly or we speak too loudly, and it's like Goldilocks. It's somewhere in between, right? You have to speak slowly, you have to speak confidently, you have to be able to convey the point that you're making in a very clear and concise manner. When somebody asks you a question in the interview, there is a certain sweet spot of how long you speak. It's somewhere between 30 to 60 seconds at the most, even for the longest of the questions. After about 30 to 60 seconds, people, essentially lose interest. So you have to be able to convey your information, convey what you're saying in about 30 to 60 seconds, and then it can lead to follow-up questions and follow-up things. But don't rush, don't interrupt people when people are speaking. Stop and listen, understand what they're saying. It's very sort of rude to interrupt someone in a conversation. Let them finish. There's something called active listening. It's not just a matter of listening to what they're saying, but actively listening, meaning that you're comprehending what they're saying, but also your body language, your mannerisms, your everything conveys to the other person that you are actually paying attention and listening to them. So maintaining eye contact, responses like, oh, really, okay, things like that. So those are things that go a long way. And use professional language. Don't use slang. Don't use filler words. This is very common. The most common one we see are we're like, and, using the word like 4 times in a sentence. And the most important thing I would say, which is very challenging for IMGs, is if you don't understand something, stop and ask. Dr. Smith, I'm sorry, I could not quite follow your question. Would you mind repeating it for me? Is perfectly acceptable. Instead of misunderstanding the question and giving an answer that, maybe is not what they're asking. So stop, ask. If you don't understand something, ask them to clarify. Any questions, comments?
I think there are a couple of them on the chat.
I think that's more for Nishant.
Yeah.
Just want to add.
Yeah, please.
This is Dr. Manisha Jham. I just want to add what Dr. Panala just said. I think it's a very important point that people are judging you on, how well you speak and how easy it is for them to understand. Because what they're trying to see is, like, if you wake them in the middle of a night and present a case to them, will they be able to understand what you're saying? Just speak slowly and very clearly.
Yeah, that's a great point.
That's one of the big judging points for a lot of IMGs.
Yeah, that's a great point, because you are going to be in that situation. You're going to be the intern, or you're going to be the second-year resident, and it'll be your responsibility to call your attending at 3 a.m. And of course, you don't want to call them. They don't want to be called. But can you convey your information in the shortest possible time and convey it correctly? It essentially comes down to organizing your thoughts. That's what they're looking for. And how you organize your thoughts is how you project them, even in an interview. So there are common questions These are things that you don't really have to stumble because these are very predictable questions. Preparation is going to take care of a lot of these. There's a question from Saeeda about weakness. So these are some of the common themes. There are more. Tell me something about yourself. Almost all good interviewers start with an open-ended question. So one thing to know about, you are interviewing, and there is a spectrum of ability and competence in how you interview, but there's a similar difference in ability of the interviewers, right? Some are good interviewers, some are bad interviewers, some are in the middle. So there's a bell-shaped curve for even the interviewers. The best interviewers always start with an open-ended question, and you sort of talk, you know. On the other end of the spectrum are people who give you very scripted, tell me 2 weaknesses or tell me 3 strengths of yourself, you know, rather than saying, okay, tell me about yourself. Or what would you tell a stranger if you met them and they wanted to know about you? So those are very hard, but those are predictable. Those are some things that you can prepare for. Research, like Nishant was saying, can you talk about your research for about a minute and be cogent and coherent about it? Tell me about an interesting case. That's the most common thing that we see, especially as they talk about your U.S. clinical experience. And what they're seeing there is not how interesting the case is or what what a rare syndrome that you saw and you were able to talk about this ultra-rare syndrome. No, that's not what they're looking for. They're looking for you giving something interesting, you know, and this is an example I always give. You want to give an example of something like, oh, you know, we had this patient, he was complaining of, a lot of nausea and really appeared very weak. All his scans were negative, and we really questioned him. And then we thought about, on examination, his skin was like this, and we thought about Addison's disease. So what they're looking for is what is something interesting as a physician, some clinical examination findings, physical findings, something like that, or something in the history. So presenting an ultra-rare syndrome is a very bad idea in my mind for that. I don't know how others feel, but, it has to be something interesting. And then you have to, and I'll let people jump in a second, and also you have to talk about those scores, your gaps, your attempts, have a very, explanation, what has happened. That's actually very important. Any other thoughts, comments, guys?
Okay, I would like to just give a few answers what they were posting for questions they were posting here. So I think it's good to talk to everyone rather than typing there. So the question is, someone was asking me what's the difference between neurology and IM when it comes to research and scores. So I think they both are same, and research is more concentrated university programs, and the perception we have that neurology prefers research is because all the neurology programs in the United States are university programs. And coming to scores, I have seen people with PhDs and good research, low scores getting interviews, and people with 250s, 260s getting interviews. What matters here is, in my experience so far, it's application as a package, the whole package. It's not like concentrating on one thing. And definitely when ranking, people do take into consideration the whole application, what's your scores, what's your experiences, and within what time span have you, within a certain time span have you accomplished your task. I mean, say you want to do a voluntary research experience while you are interviewing, that shows your interest more into the system, more into the, the more interest in the subject, like neurology, where you want to go. Suppose you mention endocrinology or gastroenterology as your subspecialty in your personal statement, and while you are applying for interviews, if you mention that I'm volunteering at so-and-so department, that shows your interest, and that shows that you're committed to your field. That's what I feel. And the other question said, what's the difference? Wait, give me a second, just see here. And if you have a clinical experience in IM and applying for neurology, I think it doesn't matter because you can just say them, you're trying to, the purpose we come here is for a kind of experience in the system. And they're not seeing that whether this guy rotated in neurology or gastroenterology or any other thing. What with the clinical experience here, what you're showing is that you are able to get acclimatized to the system and you have some experience with the system. And I don't think so it matters so much. And definitely it's very good to have some experience in the department or in the subspecialty which you are applying for, but it doesn't matter if you don't have though. That's what I feel.
Yeah, and that applies to a lot of things. It's about whatever the experience is and whatever you have on your CV and your personal statement is how you present it and how you sell that. So, you know, it has to be how you talk. So,
I wanted to add one thing. You know, I know some of the applicants have put like cases, interesting cases in their personal statements or in their CVs. I just wanted to say that, you know, if you put a case about a specific diagnosis, you need to know that diagnosis inside out, because there will be this one interviewer who knows a lot about it and he's going to catch that and he'll want to talk about it. So if you put a case or any topic, let's say, you know, you said Lyme disease or whatever, then you should know inside out about that disease. Because if that one interviewer finds it interesting, he's going to spend his whole interview on that. So I just want to let you know that, you know, just be careful about that.
Nishant, I think those are important points.
Yeah.
So in the interest of time, I'm going to about how to talk and handshake and addressing people really. And just we want to spend a few minutes on talking about the interview day. You know, you really want to take care of the logistics. You don't want to let the mundane bog you down, like parking and cabs, and you know, these are very obvious things, but you don't know anyone there, so be nice and pleasant to everyone you interact with. You know and remember the names of not only the program, the people who interview, but the program coordinator, the residents, the attendings you meet. Take some notes, carry a copy of your CV if people ask you for it, an updated copy, or if you have something that has changed since you put your application in, carry a nice copy of your CV. And then moving on to tips for the interviews, you know, really we wanted to say start early. Everything on the application is a fair game for your interviews. Think about what you want to say. Don't make your answers very canned and scripted. You have to be conversational. And the way you get there is to practice, practice, practice. And then, you know, this is the time to shine. You've put in all the hard work. You've taken all your exams. You've done all your rotations. You've done all that stuff. This is the time to sell yourself. And I keep using the word sell because nobody else is going to sell you. You have to be the one who has to sell yourself. And you are the product, and you have to be the person who has to sell that product. So think of it that way. If you want to sell something, you need to be really engaged and confident about the product, and that's what you should be. So I'll turn it over to Pawan to just talk about how we can help and things like that. So.
So thank you, Rahul. In the last couple of minutes, you know, you can go on our website, and we have a fairly extensive methodology where we can help you with one-on-one mentorship, you know, live interview prep, coaching, and mock interviews. And here's the website and all details about us. But I do want to, in the last minute, go around and get some final thoughts. So Nandita, you know, are you still there? You may have dropped. Okay. Abhilasha, are you on? Yeah, it looks like they dropped. So, Mohit, Manisha, if you were to say, the one last minute thing on what are the important things they should just prepare, focus on, anything that we haven't covered, anything at all?
I think I just want to reiterate that during that 15-20 minutes you get with an interviewer, you're trying to sell yourself. So don't be modest. Use words that describe you, like a hard worker, you're passionate, things like that. Interview is not a place to be modest. And there you get the opportunity to toot your own horn, and then that's what you should do.
And I would say, just before you go for it, just go over your application one more time, because the worst case scenario would be like if an interviewer asks you something from your application and you have a blank page, that would not look good. So go over your application, whatever you mentioned, refresh your memory about your experience in that situation, and go from there.
Yep. Nishant?
Okay, I would say have some practice, because being an IMGs, you don't have, personally I don't have any interview experience before, but that helps if you have practice. That's the main thing I would say.
Okay. All right. So I think that pretty much wraps it up. Thank you everyone for joining. Appreciate your time, and of course you can get in touch for any other questions that we can help answer. Of course, we'll post a copy of this on our website as well as the YouTube channel so that you can refer to it later on as well. So thank you everyone, and have a great weekend. Thanks Nishant, Abhilasha, if you're still on, Mohit,
My
Manisha,
pleasure.
Nandita. Thank you everyone. Thanks.
Yeah, thank you.